it's Alex here from Aleks Physio. Today I wanted to talk to you a little bit about pain. So pain is a very complex topic that is an experience. It's an experience that's associated with actual or potential tissue damage. Now in the past, people would always think that pain was just purely physical, it was purely structural. If you have pain, it means there's some sort of tissue or part of your body that's damaged or injured or irritated that's causing your pain. But more and more research is coming out that's just showing that it's a lot more complicated than that, and other factors are also playing a role, which explain why some people are having higher levels of pain than others, even though they might find the same thing on an x-ray or an MRI scan. So what are some of these factors? Things like history of depression, anxiety, your social support, your past beliefs, your experiences in the healthcare system, stressors in life, your sleep, your nutrition, all of these play a role in how we perceive pain. So research has actually shown that, they would compare different populations, they would do x-rays, MRIs, and they would compare people with pain and without pain for various different types of conditions. It could be back pain, rotator cuff tears. They find out that there are people who have disc herniations, there are people who have arthritis, there are people who have rotator cuff tears, have pain or don't have pain, and it doesn't matter if they actually have a rotator cuff tear or not. So people might not experience any pain and have a rotator cuff tear, but people might have a lot of pain and have no rotator cuff tear, or no pathology that may be indicative of an actual issue from a physical perspective. Pain is a very complex experience. We as human beings are very complex individuals, and the way that we structure our thoughts and our beliefs about pain can actually play a significant role in how we experience our symptoms. So, one of my roles as a physiotherapist is really to teach people about pain, assure people and let them know that movement is okay. They're going to be okay. Their bodies are strong structures that are able to tolerate a lot of demand and load that we put on them. And our bodies have a very strong capacity to heal. And we have the ability to adapt to whatever loads we put on them. So for the patients out there, just to let you know that, there are ways that you can deal with the condition and get better and not feel like you need to have surgery or you need to have any sort of cortisone injections or be on heavy medications. That there are other things that we can do to try to help manage the conditions, because pain is such a worldwide issue that we have, and it's one of the top causes for people to come in to see their family doctor. The longer that people have pain, the more sensitized their body is, and the better they are at actually producing pain. So for example, generally tissues take anywhere from 6 weeks to 3 months to heal, and anything longer than that, it's usually not an indicator of an actual physical injury or tissue damage. It's more that your body is very sensitized. So if you've been having pain for such a long period of time, then you tend to associate different movements with pain. Different things that are going on in your life can be linked to pain, and all of these makes the connection between pain and your back or your neck or your shoulder makes the connection stronger. So that every time you do that certain movement, it just triggers the thoughts and it triggers the memories of when you tweaked your back, when you reached down and picked up something from the floor. So just understanding that the longer you have pain, the better your body actually gets at producing pain, and it kind of becomes a loop, right? So if you're in pain, then you're likely to think about the pain more, you're likely to do less, because you think when you do more, you actually are making things worse, and it just becomes a feedback loop that makes things worse and worse, right? Because it just exacerbates the problem. When you go somewhere and somebody you go to a healthcare professional, maybe a physio or a chiropractor or a doctor, and they just exacerbate the problem by saying, oh, avoid this or avoid that, then it also instills more fear. So now, the things that you were doing before that gave you meaning, now you're very hesitant to do it because you think that'll make things worse. But understand that just because something hurts, that you're not actually doing any harm to it. So it's not always, right? Sometimes it could be irritating, but it's not always. So trying to understand the association between the two and not pigeonholing yourself and stopping to do things that give your life meaning and value just because you're in pain is something that's really important. So, a good physiotherapist will ask you about your hobbies, interests, goals, things that you want to get back to doing, and then we work towards them.